Hello, thank you for joining. This is the Parents Playbook for Special Education Success. I'm Michelle Kotler, attorney, educator, and creator of the Parents Playbook. And with me today, I have my first inaugural interview with a guest speaker. We have Ashley Schwenn with us today. She is a licensed educational psychologist from California with a wealth of knowledge and deep background in the area of disability evaluations and eligibility determinations, as well as participating, I'm sure, in some IEP development and working with parents behind the scenes to encourage them to advocate for their kids. And that's where we connect around that, the understanding the need for advocacy and for parents to be strong, reliable advocates for their kids. So Ashley and I have come together to chat a little bit today. And Ashley has a really amazing background. So, in addition to her bachelor's degree in psychology and her master's degree in school psychology, she also has a postgraduate certificate in neuropsychology. So, we'll ask her in a moment to explain the difference, what neuropsychology actually is from regular psychology or school psychology, to kind of help us understand some of these nuances a little bit. She also is an adjunct professor at Loyola Marymount University, and she's also been a professor at University of Dayton, originally from Ohio. Ashley has a long history of working in public school systems and also privately with clients who require educational or psychoeducational evaluations, neuropsychological evaluations, and currently is in private practice offering independent educational evaluations. So we'll get into that in a bit. She's also uh, a published author. She's done a number of research projects. She's had several memberships, including being president of the South Bay School Psychologists Association. And she's also been a member of the National Association of School Psychologists. I noticed actually, Ashley, that you had won School Psychologist of the Year in November 2021 from the Ohio School Psychologists Association. So kudos to you. I'm sure that's quite an accomplishment.
Thank you.
Ashley's also presented at numerous conferences around the country and has been published in several publications. So I'm going to let Ashley take it away and tell us a little bit more about her background and what kind of led you into the area of psychology, school psychology, and neuropsychology, Ashley.
Absolutely. So I knew always that I wanted a job working with children. I love working with kids. They're so much fun. I identify very well with them. Spent a lot of time nannying back in the day and just wanted to save the world and help children. So I started out in college as a pre-med major thinking I would like to be a pediatrician. And then I failed organic chemistry and was taking my science classes. And so I was always a psychology major. It's always an interest of mine. So I went in that direction. I got a minor in child studies. I did some research on a buddies or bullies study. And in that, I got to do a lot of assessment in schools with children. And that was really exciting for me. And like most people in school psychology, I found out about the field by accident. Students at Miami University in a school psychology program came to talk about school psychology, what it was, and I thought I have to do that. So I interviewed and worked for a school psychologist in Oxford, Ohio, in my college community, and I was hooked. So I did my graduate training, loved the field, and in my 14 years of working for 6 different districts in 3 different states, I've come to learn quite a bit about what works well in school systems, what doesn't work so well in school systems, and how state laws can and training requirements can greatly impact the education of students. So, most recently, when I was working in a district here in California, it was a wonderful experience. I did my best to change the system, and I realized that I wanted to pursue my passions further to be able to do work with families in a little more of a creative way without some of those boundaries created by school systems. So I decided to open my own private practice. I first became a licensed educational psychologist, which allows me as a school-based school psychologist to practice privately within the state of California. And I really wanted to focus on being very relational with families, providing them a solid, comprehensive evaluation, and helping them advocate for services for their children.
That's wonderful, Ashley. Thank you so much for explaining your background. In terms of independent educational evaluations that you provide through your private practice, can you explain for parents who may not be familiar with them why they are such a powerful tool and how they may be different from the evaluations they would get through the school system?
Absolutely. So, in the school system, you might request an evaluation from the school system to be conducted with your child. The school system might recommend an evaluation, and that evaluation occurs. As the parent, you might agree with that evaluation. You think it's comprehensive, and that's wonderful. Then we can move forward with developing your child's IEP. However, there are cases in which you might feel that your evaluation for your child was not very comprehensive. Maybe you felt there were skills that they missed. Maybe you disagreed with the results of the evaluation. And in those instances, you have a right as a parent to request an independent educational evaluation or an IEE. And that requires the school district to pay for a private party, such as myself, to do a second opinion evaluation to give that unbiased outside perspective of what goals should be in your child's IEP, what accommodations should be in the IEP, what services should be in there, are there additional evaluations that need to be done, as well as is your child placed appropriately within their educational program. And the goal, especially with the work that I do, is to help bring that school team and that family back together to make sure all of the needs are identified so that that student can move forward most productively in their education.
Wonderful. Thank you. And just
Mhm.
to dovetail on that a little bit, for parents who are interested in getting an independent educational evaluation paid for by your public school system, please just note that you have the right to request that evaluation. But if the school system decides they want to kind of fight against that and not agree to pay for it, they can file for a due process hearing themselves to prove to a hearing officer why the public evaluation was appropriate. So just know that if you do make that request, you may possibly be triggering the school system to file for due process against you, essentially. That doesn't often happen, but it can happen, and it does happen. So I just want to make sure parents are aware of that. Very often, those school systems will agree to pay for an independent educational evaluation, particularly if they know that their own public testing was quite lackluster, had maybe some inconsistencies. I've seen things where reports might contain a different child's name, for example, or refer to a
Mhm.
different gender of child in the report. Things that kind of obviously look like it's a copy and paste job that really strengthens your case for an IEE, for example. So, in terms of having worked both inside public schools as well as outside the public school system, which I've also done myself as an educator and as an attorney. I never worked as an attorney for a public school system, but I've worked as a teacher and a school administrator for public school systems. What should parents know about how school teams make decisions about eligibility and services? And if you can maybe contrast your role, public and private, as like how you would view the same scenario, for example, and how you would make that decision differently depending on which hat you're wearing.
Absolutely. So within the school system, we're bound by a rule book called the Individuals with Disabilities Education Improvement Act, or IDEIA. It's a law that basically ensures the rights of students with special needs, and has evolved over time since 1975. Also, in terms of eligibility, what we're looking for is based on all of the evaluations that were conducted in the school setting, what eligibility category most comprehensively captures the totality of your child's educational needs. So, semantically describing what label, essentially, it is a label, will most comprehensively describe what's going on with your kid. Now, let's say you have a kiddo with autism that has learning disabilities, maybe in reading and writing. So maybe they would qualify under specific learning disability. Maybe they have ADHD, anxiety, OCD as well. That would fall under other health impairment. Maybe they also have some speech and language difficulties with receptive expressive language, articulation, or pragmatic language skills. So they would also qualify under specific or speech language impairment. And then also maybe they have some very disruptive behaviors and they could also qualify under emotional disturbance. But while they would meet criteria for those disability areas, what we want to select for eligibility purposes is autism, because all of those areas of eligibility, all of those comorbid disabilities often co-occur with autism. So in that realm, autism would be the most specific category. Now, why is it important? And in some states, you can select one eligibility area and that's it. You pick one. But in other states that I've worked in, you can pick two. You can pick a primary and you can pick a secondary eligibility. And so for a kiddo with autism, maybe it's common to see autism primary, speech and language secondary, maybe OHI secondary if they're very ADHD, or secondary, a specific learning disability if they have some very specific learning disabilities. But just really thinking about what are those primary descriptors that comprehensively explain the totality of that child's educational needs. Now, the eligibility category is not supposed to drive placement in special education services. It's also not supposed to drive the type of goals that your child has in their IEP. Regardless of the category that your child is eligible under, they should receive goals and services in accordance with their educational needs that were identified as a part of that evaluation that was completed. So that's kind of how it operates in the school system. Parents come to me privately, and let's say I administer my psychoeducational evaluation or my neuropsych eval or my IEE, and I diagnose a kid with autism using the DSM or the ICD-10 codes. And I say, your child has a diagnosis of autism. Now, maybe they haven't yet received special education services in the school. And so in that case, the family would take my private evaluation and diagnosis to the school system, and you would have to request an evaluation. And the district would be legally obligated to consider the results of my evaluation, but they're by no means required to do anything that I recommend at all. That's where your job as the parent advocate comes in, is advocating for that evaluation, sitting in that meeting, making sure that they've considered the results of the outside evaluation in addition to conducting their own testing, which often has to also occur after you request that evaluation and give that private eval to the school. They have to do their own evaluations, and that falls within a 60-day timeline, after which they'll meet to review the results and determine if your child's eligible for an IEP. So those are kind of the differences between how eligibility operates privately as well as in the school system. And sometimes a private evaluator might introduce a new possible eligibility category. Maybe I uncovered dyslexia and we want to look at specific learning disability in addition to autism, etc. The possibilities are endless.
Right. Well, thank you. I appreciate you elaborating on that. Getting to your point earlier about the eligibility decision should not drive the services or the placement. You're correct. Legally, they're not supposed to drive those things. Unfortunately, though, in reality, often, depending on the jurisdiction, it does. So, for example, I was working in a Florida public school, and regarding autism diagnosis, actually, we got a student in middle school who had severe autism and had been in self-contained classrooms at the elementary level that were more of a multi-categorical type of classroom. But then when he proceeded to secondary education, and I was working at a middle school, those types of classrooms went away, even though they
Mhm.
need to have a continuum of alternative placements at all ages. School systems are not always aware of that fact.
Yes.
Or they disregard it,
Yes.
we don't do that here. Our favorite line, we don't do that here. You know that, right? We hear that a lot. We don't do that here. We don't have that here. So this young man had been identified as being language impaired. This public school's own psychological evaluation showed autism since he was young, and like severe autism. But because he was language impaired on paper, he was placed in general education classrooms in middle school where all he could do was draw pictures and watch YouTube videos. And then it took a year because all the testing had to be redone and the meetings had to happen and all these things had to happen for him to actually be identified as having autism and then be placed in a self-contained classroom environment that was more appropriate to meet his needs so he could maybe do something other than draw pictures and watch YouTube videos. It was absolutely, to me, I mean, my head, it was all I could do for my mind not to explode. Yes. Very frustrating. Very frustrating. So that's just one example. I had another young man who was 16 years old, born profoundly deaf, and no one ever knew until I figured it out and took him myself to get his hearing tested. And they all said, oh, he's got ADHD because he kept saying, what, huh, what, huh, what, huh, what, huh.
Oh,
Like, maybe he can't hear. And he
right.
couldn't, and was reading on a first grade level at age 16. So the importance of appropriate evaluations and eligibility determinations cannot be understated because the whole trajectory of a child's education can be distorted and disrupted and inappropriate from the jump if that foundational information is not correct. Um, then everything else can stem from that. So that's why, the role of someone like you who does an independent and really comprehensive outside evaluation can be so valuable and so important to really figuring out what's going on and making sure the child gets what they need. So
Absolutely.
thank you for letting me share my my stories from the trenches there. So, in
Absolutely.
terms of parents who may feel sort of overwhelmed or intimidated or like don't really know where to start in terms of getting help for their child, are there any tips or tricks that you can give them to give them some guidance?
Absolutely. So, the first thing that can be most powerful for you as the parent is to take some time to educate yourself about your child's disability. And if you're not sure where to start with that process, reach out to the school psychologist in your school district. Reach out to a private provider that your child might have. Maybe they have regional center services, or maybe they get private speech and language or OT services. Reach out to those professionals and use them, use their expertise, use their resources. I'm a member of the National Association of School Psychologists, the California Association of School Psychologists. They have fantastic resources for families to understand more about their child's disability. Here in California, there's also a provider that I pull from her resources all the time. Her name is Dr. Liz Anghoff. She has a lot of really fantastic resources to use plain, understandable language to explain neurodiversity to families, autism, ADHD, learning disabilities, behavioral issues. Those are a lot of wonderful resources. So, the first step is to educate yourself about your child's disability and the types of IEP goals they should be addressing. Also, you can go through your child's evaluation and compare it to their IEP. So, going through the evaluation, if it's a solid evaluation, usually in there they will specifically list each of your child's educational needs. Then you look at the IEP and you say, okay, is there a goal that is addressing each of my child's educational needs? And if not, that's your cue to ask for more. That's your cue to say, hey, I notice you're not addressing this educational need. I want some goals added. Or For example, my child is having a lot of speech and language needs, or I notice my child has some other motor needs. Could you please evaluate those to see if they might be eligible for more services? Here in California, you can request an educationally related mental health services evaluation if your child also has some mental health needs, such that in addition to the counseling that the school can provide through the IEP, you can see if your child might also be eligible to receive additional therapeutic services through the school system. So again, build your knowledge, compare those evaluations to your child's IEP, and maybe your child has new needs that have come along since the last evaluation has been done. And at that point, you can request an early re-evaluation before that 3-year mark. So you actually have a right to request a reevaluation of your child's needs if they're eligible for special education once per annual cycle. So those are not all the ways, but just a few of the ways that you can take action as a parent to better support your child.
Wonderful. Thank you so much.
Mm-hmm.
From the legal perspective, some of the issues that I've seen regarding evaluations are things like parents making those requests and school systems not abiding by timelines and sort of dragging their feet and dragging out the evaluation process, sometimes a whole school year or even more. So always make sure, parents, that you put any of those requests in writing with the date on it so that you begin the legal timeline and there's some accountability for that. Another issue that's really cropped up lately is this idea of using what's called RTI, response to intervention. So the law requires that if students show signs of having delays or deficits in, say, for example, reading or math, that the school system implement research-based intervention to try to help, improve their test scores, for example. And school systems do that. But what will also do sometimes is they will say, we need to collect that RTI data for an extended period of time before they can evaluate a child as who has a suspected disability for special education eligibility. And that's not what the law says. So the law does not say that they can use RTI as an excuse, essentially, to kick the can down the road and not begin the evaluation process. But a lot of public school systems haven't gotten that memo. So, and the U.S. Department of Education literally has written a memo on that, and they've told the school districts that, no, you cannot use RTI as an excuse to delay the special education evaluation and eligibility process. So I just want to make parents aware that those are some issues that are relevant to our conversation around evaluations. So in terms of these meetings, I'm sure you've attended more IEP and 504 meetings than you care to even think about.
Yes.
Have you seen times when parents did things that help them be taken more seriously by the public schools, or are there suggestions that you could make to parents that you think might help them be taken more seriously when they attend these meetings to get their voices heard?
Yes. So one of the hardest things as a parent, and being a parent of a child with a disability myself, it can be really difficult to keep your objective brain on rather than your emotional brain on during meetings. And so my first suggestion would be any emotions you have around supporting your child, any frustrations, do your best to cope with those before going into the meeting so that you can stay objective, so that you can stay patient. Also, too, in the meeting, if you're getting upset, it's okay to ask for a break. Say, hey, can we please take a 10-minute break and resume so we can come back to this objectively? That will really help with communicating to the school system that, hey, this is too much. I want to work with you. I want to be present. Other things that can help are being able to accept no from the district. So you might go into an IEP meeting. When I work with families, I send them in with a list of goals that need to be changed or added, accommodation services to be changed or added, and placement recommendations. And I also give that family a list of 2 to 3 points of advocacy. I work with them to determine what those are that they're willing to accept no on. because the reality is that school systems are set up to provide Chevrolet services. They are not set up to provide Cadillac services. And the Chevrolet services are actually what they're really mandated to provide, really to be minimally compliant, essentially, with those child's needs and meeting those in the most efficient way possible, being that they're responsible for allocating tax dollars, right? And there are limits to that. So being able to have those points of advocacy that you're willing to, maybe there were some goals, or maybe there were some accommodations, or a number of minutes for services that you really wanted, and they say, no, we can't do that, or no, the data doesn't support that. Being willing to accept no really goes a long way with preserving that relationship with the district, because it shows that you're able to compromise. And so put those on the top of the list for next time.
Right. Those are excellent points. And one of the things that I teach in the Parents Playbook is the idea of detachment. So that, and it's difficult because I'm also a mother of a child with special needs. So I can really relate to what you're saying. It resonates with me. But one of the things that is so important is to try to remain detached. Not to say that you don't care, because obviously we care and we can't turn that off, but to try to think of the child that you're advocating for as someone else's child, so that you're competent, you've done the homework, you understand the evaluations, you know the law, you know how to apply it, you know what the IEP should look like you have the competence, which then generates confidence, so that you're on a level playing field with the people at the table who theoretically know a lot more than most parents know, although sometimes I wonder. But the idea is to try to act as if you are representing someone else's child, and that you're still trying to get to your goals for that child, but to try to separate out some of that personal emotion, and it takes some of the heat out, and it takes out some of the volatility that can sometimes occur. Because if that occurs, then the school system folks just kind of shut down, and they don't want to hear anything the parent has to say. So it ends up being counterproductive. Those are some of the little nuggets that I also teach in the Parents Playbook, particularly regarding attending school meetings, but even representing your child at a due process hearing, which can be a very emotional process. And so you want to succeed, like you have to put your best foot forward. So it's important to sort of keep your eye on the prize. And like you said, deep breathing, take a break. I suggest even talking with a counselor, for parents to talk with counselors through their feelings, so that they are not as reactive. And that can be super helpful, I think, too. So I agree with you. I think that's great advice. Have you seen a success story where a parent was able to advocate and get their child a better educational program than they would have had otherwise?
I have. So I've done a number of IEEs over the past year. It's been a huge area of focus of mine. There was a case in which a child was getting ready to start the 5th grade and was not yet reading fluently.
That's right. Wow.
Mm-hmm. She was having difficulty decoding. I identified a mixed dyslexia for her, and the school district, because they had not properly identified the subtype of dyslexia, they were using a phonics-based intervention only, which did help the phonics improve, but she also had that surface dyslexia piece. And so she was still struggling with those phonologically irregular words. And the academic difficulty got to such a point that she lost all confidence in herself, in her academics, didn't want to go to school. Luckily, she had friends, which was the only saving grace at school, but all day long she struggled, and there were years of IEPs in place demonstrating that she wasn't making adequate progress toward her reading goals. And at that point in a child's education, we're not learning to read anymore. We're reading to learn. And so this issue was pervasive across her school day, such that she was experiencing significant mental health issues as well, some symptoms of anxiety and depression. So I conducted an IEE for the family and was able to determine that she was 3 grade levels below. in reading despite having received special education services for 2 to 3 years at that point. I did offer some suggestions that she be educated in a co-taught setting where there is both a general education teacher and a special education teacher. Another option was that the district allow a dyslexia specialist to come into the school or pay for that service outside of the school. And my final option was that she be serviced at a non-public school focused on assisting children with specific learning disabilities. And I was informed later by the advocate I was working with on that case that the child was in fact awarded 2 years attendance paid by the district at a non-public school. So that was such a success. I was so happy for that family. And no, it was not easy to consider their child attend a different school other than their home school. Of course, there's a social impact to that. But I'm just really hopeful that this change in her services will really benefit not only her academic stability and trajectory over time, but also her mental health.
It's wonderful. Well done. It's so rewarding when we can see something like that happen, right?
Yes, to affect change using data, not emotion, not pointing fingers, but actual raw data to make that recommendation.
Yep. Couldn't agree with you more. Just like that young man who I figured out was deaf when he was 16 years old. We went back to due process hearing and got him awarded 1,000 hours of compensatory educational services, which is unheard of. It's like,
That's
I think
amazing.
it was a record.
I've never heard of that. That's impressive, truly.
1,000 hours because he basically had lost his entire educational experience. I mean, he couldn't hear anything and he was reading on a first grade level. So then he had to get hearing aids and he had to go through language. He already had a speech therapist. You'd think the speech therapist would have noticed he was deaf. It was very odd. Private school and a very specialized type of reading instruction called Linda Midbell. I'm sure you've heard of that.
They have. It's a fantastic program.
Yes, and it was an excellent program for him, and he was able to jump ahead, I think, about 6 years in his reading skills because of all of that intervention. And he also was at a non-public school, and like we had a lot of things that had to go into place for him. But he'll never be, unfortunately, on grade level because we only had a couple of years to try to make up for an entire lifetime. But that's why sometimes it's really important to be very thorough with this evaluation process and make sure a child's really being evaluated in all areas of suspected disability and not just rely on what the public school calls an evaluation necessarily, because they don't always catch certain things. So it's, it's a real credit to you and a testament to you and the work that you do. So if you could give parents just one piece of advice to walk away with from this interview, something that you really want them to remember and take away to help their child, what would that be?
My one piece of advice to you would be to trust your mama bear and papa bear instincts. You know your child best. So many times kids at school, including my own child, they mask, they hide their symptoms, they hold it in all day, and then they come home and have a giant explosion, however that looks. If your child had the skills to cope, they would cope all day at school and come home and be fine. And so when you're in that school-based evaluation and the school's telling you, there's no symptoms here, there's no issues here, we don't see it, say for your kid with executive function issues, you're coming home and your child can't control their behavior, their emotions, their attention, their organization, their planning is not great. There clearly are skills that are missing. And the child is their truest form at home because you are the trusted, safe space for them to show themselves in all of their glory and all of their colors. Therefore, if you find yourself in a situation where the school is not seeing it, please advocate that it's clear that there's data present that your child has skills that are lagging and you do require support. And it's also really helpful to reiterate to the school system how much support you're providing to your child outside of school so
Mhm.
that they present in school the way that they do. And I'll share an example for our child. She has a psychiatrist, a therapist. She had qualified for a special intervention class. She was receiving support through a 504 plan and had regular visits with the pediatrician. We were helping her with homework and were able to say to the school, look at all these people and all this extra work that's being done outside of school so that she can present in school the way that she does. And then it was finally agreed upon that the school decided to step in and provide a little more support there, which has been such a huge relief. So I will say just trust your gut. Trust your mama bear instinct, your papa bear instinct. You know your child best. And really, please strongly encourage your team to really strongly consider that data that's collected from home.
It's excellent advice.
Mhm.
And all of those kinds of outside services that parents might be providing to try to prop their child up during the school day, there's a legal term for everything, right?
Mhm.
So the legal term for that is what we would call mitigating measures. So these are measures that you're putting in place as a parent to try to mitigate or soften the effects of the disability on your child's academic performance. And the school needs to take into account these mitigating measures, like you just said. And particularly when it comes to something like a 504 plan, for example, eligibility for that is determined as if the child were not receiving mitigating measures. So if we took all the support away, how do we think that child would look? Or how has the child looked before we put all those services in place, even on a private basis? What was going on that precipitated the need for those services? Because obviously, you didn't just wake up one day and say, "Oh, I'm just going to take her to a psychiatrist for the fun of it." Like there's a reason, right? So, like, what were the going back in time? Not asking you specifically, but just parents in general. If you have to kind of go back in time and think about why did we start going down this road with her or him,
Mhm.
and then that's the picture that you have to present to the school. And then the last point on that, I'll just say for any parents who are watching this, is to document everything in writing. So create that paper trail because you never know when or if that's going to come in handy down the road. And that can even be something as simple as sending emails just to document what's going on. I'm not saying bombard everyone with emails. We don't need, 10 emails a day, and we don't need you to be copying 20 people on every email. I mean, be reasonable. Don't go overboard. But when there are things that are happening, it is important to create that paper trail. Particularly if things are happening outside of school, the school would have no way of knowing that. But also, if things are happening in school, you want to know about that, and it's important. So if you can try to gain the teacher's trust and cooperation with kind of an email dialogue or a journal or something like that, where you can have sort of proof positive of what's really going on, that could end up serving your child very well down the road. So I want to thank you so much for your time, Ashley, and for sharing all of your experience and your wisdom with us. Before I ask you my last question, do you have any other parting thoughts or tips, tricks, strategies, advice that you'd like to share with parents? Any questions that I should have asked you that I didn't ask?
One thing that I would like to share as a person who is working privately but has spent time on the other side of the table, do you remember that the service providers who are providing counseling, speech therapy, occupational therapy, special education services, it's more the rule than the exception these days that they are overworked, they have high caseloads, very minimal support, and they're doing the best that they can at any point in time. So keep that in mind when you're in those meetings. And also, the more that you can show gratitude to the providers before offering some constructive feedback is also really going to help facilitate that positive relationship and movement for your child. Everyone on your child's team at the school is doing the best they can with what they've got, and it's very minimal resources and support, and a lot of them are exhausted, especially post COVID when the kiddos educational, behavioral, and academic needs are more severe than they ever have been before.
Mhm. think that's a really important point. And unfortunately, I've done some other videos on YouTube, which parents can find on my channel if they'd like. With the current political climate and budget cuts being what they are, unfortunately, those resources are going to continue to decrease and dwindle,
Mhm.
and the caseloads are going to continue to increase. For example, Medicaid funding being cut is going to be a major hit for the public schools because a lot of those
Mhm.
related services providers were paid for, at least in part, by Medicaid dollars, which have gone away.
Mhm.
So that means that fewer people will be doing more work, and that is not fun for anyone.
No.
And your child, your child may suffer as a result of that too. So the squeaky wheel gets the grease, but like you said, an attitude of gratitude can also go a long way. So,
Mhm.
bring the cookies, be the mom who volunteers at the parties, or, the dad who does some extra special thing. And I hate to say it, but it's human nature, and people do tend to go a little bit above and beyond for people that they really like. So,
Mhm.
that's a good way to try to grease the wheels as well. And unfortunately, if that doesn't work, then you may have to become a little bit harsher in how you approach things, but we always want to try kindness first, right? And to your point,
Absolutely.
earlier you said I liked your analogy about a Chevrolet versus a Cadillac. So
Mhm.
boy, does that take me back. I can't tell you how many times I was sitting in a due process hearing and the school district lawyer said, "We don't have to give the kid a Cadillac." Like that's their favorite line. And then the parents' lawyers like me would come back and say, that's true, but the car you give them has to have an engine that works, brakes that work, four tires, and a steering wheel. So
Absolutely. Yes. Yes.
I was ready for that comeback. But boy, have I heard that Cadillac line 1,000 times.
It's one of the first articles I read in graduate school. It's really stuck with me.
Yes, it's a perfect analogy. So,
Yes.
Ashley, if parents in California are looking for an independent evaluator to do a psychological or a neuropsychological evaluation for their child, is there a way that they can find you and get in touch?
Absolutely. You can find me on LinkedIn. You can also find me by Googling my company, Education Innovators Consulting. And my new website is going to be out very soon. The tagline is myedinnovator.com.
Great. And I'll drop that link in the description below this video as well. For those of you who are watching or listening on YouTube, you can find it there. So thanks again, Ashley. It's been a pleasure talking with you, and I wish you the best of success for you, for your child, your family, your company, and all the children's lives whom you touch.
Thank you so much, Michelle. I appreciate that. And likewise, thank you for all that you've done. And it's really amazing to see a special education attorney who's also spent time in the trenches. That adds immeasurable value to the services that you provide and quite an amazing perspective as well. And so families would be very lucky to have you
Thank
educating
you.
them.
Thank you. I really appreciate that.
Mhm.
Thanks so much.